Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education. Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm really delighted and excited to have as my guest, Dr. Meagan Grega. Meagan is a medical physician who's board certified in both family and lifestyle medicine. She's a fellow of the American College of Lifestyle Medicine. She's the co-founder and medical director of a group called the Kellyn Foundation, which we're going to talk about, their Healthy Immersion program. And Meagan, welcome. I'm so happy to meet you and see you.
Thank you, Dr. Sabatino. It's a pleasure. I am really looking forward to our conversation today.
Yeah, just to get some background on you, I in going over your background, there's so many interesting parts of it, but I did go through your TED Talk too. And I know that early on you had this goal of being a shaman in your community, which obviously didn't quite work out, but in a way it kind of did actually. Mm-hmm. But based on your movement into family medicine and lifestyle medicine, what were some of the ways that you were thinking about that long before medicine? Was that something that was part of your mindset in the earlier stages of your life? Did you have any fascination with animal rights or the environment or anything that struck you in high school or earlier on in your life that became kind of a motivating force later on in your life?
Well, that's a great question. I hadn't really thought about it that way before. I would say environmental rights, yes, but I've always had a passion for service to others. So volunteering with my church community when I was younger, or other things like when I was in high school, helping out with other people in our community. That's always kind of been the way that we have a passion to enjoy, and I feel like I actually get more out of that type of a interaction than if it's just more of a transactional sort of thing. So that's been something that I've done my whole life. Environmental issues were important, and health was always very important to me. I actually was a lifeguard when I was 15. I started lifeguarding at 15. And so that kind of idea of taking care of others, making sure that everybody was safe, is something that I've been doing for a long time. And then when it came time to choose a career, like you noticed in my TED Talk, what I really wanted to be was a shaman. I wanted to be that sort of spiritual and also health and emotional leader in a community that was there and knew people's stories and was a part of their everyday life and was somebody that people could turn to when they needed help. And so I thought, okay, well, what's the most modern equivalent of a shaman? And family medicine seemed to be what would be the correct career path for me.
When you were on that path, had you already made choices that were more plant-based at that point, or was that something that came on later? When, how early in your life did that mindset become part of how you lived?
That actually started later, believe it or not. I come from a family that's very kind of standard American diet, not just meat and potatoes, but also ultra processed foods, all those things that my parents are baby boomers. They're amazing. They, really focused a lot on service to others and education and equal rights for everyone. So I got a lot of great background from them in those aspects. But food was not necessarily something that was a big focus in our family. They were both working professionals. So, things like Hamburger Helper and pasta with meat sauce and other sorts of takeout types of foods. So I really kind of thought of food just as fuel growing up. It wasn't something that I really paid a lot of attention to. It was kind of whatever was in our house or wherever I was, I ate. That got worse in medical school and in residency, as you can imagine, because it's very difficult to find healthy food, especially back in the 90s at that time, to be able to fuel my body. So I really just grabbed whatever was available, drank way too much soda, which is something that I learned was not going to be a good long-term choice. Ate a lot of things like French fries and pizza and sandwiches because that's what was around. And so it was really later in my medical career when I found all the research with Dr. Esselstyn and Dr. Ornish and Dr. Barnard, where I realized how important it was for nutrition to be a different kind of impact on my life. And as you know, there's not much nutrition training in medical school. So I definitely didn't learn it there, and I didn't learn it in residency.
Well, residency programs are kind of the antithesis of lifestyle medicine. Let's be realistic. You know what I mean? With all of the ways you have to kind of move past everything that's supportive in lifestyle. No sleep, no this, poor food, you know, it's all of that.
Don't have time to go to the bathroom, you know, everything. You know?
How did that dovetail into your service in the Navy? That was kind of interesting to me. Was that something that you had enlisted and they paid for medical education? Was it that kind of a thing that went on? Or
Well, I actually come from a military family. So as I mentioned, there's kind of this tradition of service in lots of different ways in my family. So I was actually born on a Navy base. My dad was in the Navy during Vietnam. And so I grew up with I didn't stay in the Navy. He was in the Navy for a while, and then he left the Navy and, you know, got his MBA and kind of went on with his career. But the military has always been a big focus in our family. And so when I decided I wanted to go to medical school, I went to the University of Pennsylvania, which is an amazing medical school, but also a very expensive medical school. And I had initially thought that I was going to be a pediatric oncologist. That's what I thought I was going to do in medical school. And so I thought that should be fine. I'll go to Penn and, you know, I'll be able to pay back those loans later. As I was there for probably about my second year of medical school, I realized really what I wanted to be was a family doc, because that is more in line with the whole shaman part that I had been talking about before. And also because I love kids. I loved the concept of oncology. I'd done some bone cancer research before medical school. So I liked the science part, but I didn't think that the lifestyle of what that would be like for me and for my family. And also it's kind of like you're intervening at the very end of a process as opposed to hopefully preventing it in the beginning. I'm so thankful that there are pediatric oncologists. I just realized that that was not the right career path for me. So at that point, I realized I was going to be trying to have a primary care doctor salary on a University of Pennsylvania loan and thought maybe the military might be a good thing for me to do. So I actually had a couple of years that I was a health professional scholarship student, and then did my residency training in the civilian world, but then went on active duty.
I see. And active duty, I'm assuming you went to different parts of the world. How did that work out?
So I actually was pretty lucky from the standpoint of my family standpoint, is that most of my postings were in the United States. But at the time that happened, it was during the times of the bombing of the USS Cole and the 9/11. I was on active duty during that time. So I was attached to the USNS Comfort, which is one of the hospital ships, but I was not one of the people that was selected to go. I was one of the ones who was selected to stay stateside and kind of keep the branch medical clinics and things running. So mostly I was here in this area. Well, not this area of the Lehigh Valley where I am now, but in country. Now, I probably would have eventually ended up in other places overseas, but I ended up deciding to resign from my commission after I'd been in the military for a bunch of years and said, I'm going to go back to civilian world and have my kids be able to grow up close to my parents and be able to see my grandparents, and decided to really put down roots where I grew up.
Yeah, so let me ask you a question, because you make this point that you, like many people and physicians that have gotten into lifestyle medicine, they've surveyed the field many times in their own personal experience. They've confronted the idea that through medical training, you're trained to be a disease manager, not really a true healthcare provider. This is the way I'm phrasing it, meaning that you're not really dealing with the underlying causes of things and revolutionizing or reorienting those choices, but holding people's hands while they deal with the ongoing system of changes that they're experiencing, whether it's diabetes, heart disease, or whatever. So as you went through that, you talk about the discontent that you experienced with that. So how did that take shape in your professional life? What was the path, in a sense? Share with our audience how that evolution of discontent moved you from that idea of being just a disease manager into someone who really wanted to deal with true lifestyle healthcare.
And as you mentioned in the TED talk that I do, I really wanted to be a healer. I want to be a shaman, want to be a healer. So not just, as you mentioned, a disease manager, which is unfortunately how a lot of doctors have kind of been forced into practice now. And in the beginning of your medical career, really your medical training, in the beginning of your medical training, you're just trying to learn stuff. You just want to know what to do, what's the right thing to do, how do you evaluate, how do you treat. And so for the very beginning of my medical career, for my medical school and residency, I really was just trying to absorb as much information as possible so that I could be the best doctor that I could. And I didn't have a whole lot of discontent at that point because I was just like, this is my time to learn. I need to know all this stuff. But then when I went out into practice and I had my own patient panels, and over the years was seeing the kind of long-term effects of what the standard American lifestyle is like, not just in my own patients, like the adult patients, but as a family doc, you see all the way from the kiddos up to the great grandparents. So you see how it plays out in a family as well, or in a community. And during that time, I was getting very frustrated because I thought, I've been taught what's supposedly and is the best evidence-based medicine that we have here in this country. And that's a lot of evaluation and procedures and pharmaceuticals. And what do you do when somebody has high blood pressure? How do you deal with that? And I really had not learned anything about lifestyle medicine because lifestyle medicine wasn't a specialty. It wasn't something that people were really talking about when I was in medical school or residency. I mean, yes, everybody knew you were supposed to eat better. But what does that mean? What does eat better mean? And everybody knew that you're supposed to exercise more, but how do you actually help people do that? And sleep wasn't even a thing that people were really talking about that time. So my discontent got more and more as I saw the patients that I really cared about getting worse and worse, even though I thought I was doing all the things to help them the best that I knew how in medicine. So people were getting their second coronary artery bypass, or they were needing more and more insulin or more diabetic medications to keep their blood sugar under control, or they're getting amputations, and I thought, if we can't actually restore people back to health, that's what a healer is really about. And that's when I got so frustrated that I began to look into the medical literature that I really hadn't been taught in medical school or residency. And that's where I found kind of the lifestyle medicine pioneers of Dean Ornish and Caldwell Esselstyn and T. Colin Campbell and Neil Barnard and John McDougall, the list goes on. But I had never heard of these people. I'd never seen their research until I started looking into it myself. And I really got into doing it myself, or looking into it myself, I should say, when I saw how kind of unfit and overweight the kids in my practice were becoming. So young children, year after year, were becoming more and more overweight, less able to do cardiorespiratory fitness things. And it really just seemed like they were on this trajectory to end up with chronic disease in their 30s. And I wanted to be able to do something to impact that. And that's what got me down the whole kind of like path of learning about what we now call lifestyle medicine.
Beautiful. Before we go on, we're going to take just a short break to hear from our sponsor, the National Health Association. I'm here with Dr. Meagan Grega, who's a specialist in family medicine and lifestyle medicine, and we'll be right back. You're listening to the NHA Health Science Podcast. Dr. Frank Sabatino here, encouraging you to check out the NHA membership. For just $35 a year in the U.S. and $55 internationally, you'll have access to a wealth of resources, including our quarterly full-color print magazine, Health Science. Stay updated on the latest health tools, inspiring stories, and exclusive events like the NHA Conference and plant-exclusive cruises. Join us at healthscience.org/membership and make a difference in your life and the world. I'm Dr. Frank Sabatino, your host. And now back to the NHA Health Science Podcast, where more exciting insights await you. Welcome back to the Health Science Podcast. I'm really delighted to have as my guest today, Dr. Meagan Grega. And we've just talked a little bit about, your evolution into the consciousness of lifestyle medicine. What I really want to segue next into is really a really important area, because I love the fact that as you went through your talk and your work, we all know we can get into a lot of the how of what things are doing and how they're working and how we approach heart disease and diabetes. And I always tell people science is very much about the how. but the way people function is about the why. So what I really loved about what you're doing and the brilliance of what you're doing is the idea that we need to look at lifestyle change and lifestyle choices in the context of social organization. And I want you to go into with our audience that idea of that community choice architecture that you talk about, and the idea of social nudging, which I really liked a lot, because it is a lot about how is going to be, we as you made the point, the lifestyle choices we're talking about are not rocket science. Most people know that eating better, moving more, sleeping more, having better relationships, handling stress better are all very positive things. The question is, why aren't they doing that? And so you have addressed that head on. And I want you to go into that description of that, and then we'll segue into the Kellyn Foundation, which is the manifestation of that on a community level, which I thought was absolutely brilliant. So let's go in that direction if we can, because I want people to really know that foundational work.
Well, thank you, Frank. Yes. So I look at lifestyle habits as being contagious. You are really most likely to do the things that everybody else around you is doing. And it's whatever those relationships are. So whether you have close relationships with your family or your friends or your coworkers or people in your community, if they're all going out bowling, there's a good chance you're going to go bowling as your recreation too. And if depending on what they're eating, there's a good chance you're going to be eating very similar foods as well, because that's the social nudges, like we were talking about. The social nudges around you are saying, hey, it's Thanksgiving. So on Thanksgiving, this is what we eat, because, as a community, that's what we do. And I think that there's a lot of power in social nudges, both for potential good or for potential ill, depending on what those social nudges are kind of encouraging you to do. Same thing about choice architecture, which is the default of whatever choice you have around you. So say you want to have some healthy fruits and vegetables or some whole grains or something, but you live in an area where there's no access to that type of food, or at least no easy access. So then your default choice is probably going to be takeout food or kind of ultra processed food. If you really have to work at getting whatever sort of choice we're talking about here, you're probably not going to be able to access it. I mean, you talked about residency being completely anti-lifestyle medicine, and I agree with that. Think about how easy is it to get a good night's sleep if you're a resident? Not very easy, because your choice architecture is not set up to do it, to help nudge you in that direction. Everybody else around you sleep deprived. It's just kind of like what you do. Unfortunately, I feel like American society has shifted in a way that the majority of the social nudges that we get are pushing us into habits that are going to be less healthy for us, or not nourishing us, not nurturing us, as opposed to areas in the world called the blue zones, where around those places, and blue zones, probably your audience is probably pretty familiar with them, but it's areas where the whole population lives longer than average in the world. So it's kind of like a whole community of centenarians and above, not completely, but they have maybe 10 times the number of centenarians per population than we do here in the United States. And it's not that those areas have phenomenal healthcare or like magic wonder drugs. It's that their social nudges and their choice architecture nudge them into healthier choices their whole life. What they eat, how much they sleep, how they manage stress, how they move around during the day, and especially their relationships. That's actually Dr. Vivek Murthy, our Surgeon General, has really shown a light on the issue with loneliness and the lack of strong relationships that seems to be happening in the American public. So I look at any behavior change is going to be more successful if it's also kind of wrapped up in relationships, and that you have somebody who's like your battle buddy. I say, who's your ally? Who is your ally that's going to help you with this, as opposed to who's your accomplice who's going to lead you in another direction that is maybe not the direction you want to go.
There's a whole, evolutionary biological sense to that, because if you think back, you tended to want to do what everyone else in the tribe was doing, because by doing it, the entire tribe would survive more successfully. So I really believe we have that ancient directive within us. And it's also, in my mind, why, when we look at people reaching out in the dim, dark corners of cyberspace to connect with anybody that's out there, there's a really inherent drive to have that social connection and community sense. So what you're saying is grounded in deep evolutionary biology. Before we go on, what I'd like you to do is let people know where they can find you. what's a location, a URL, and then we'll put it across the screen where people can follow up and get more information about you.
Well, the best place to find me and all about Kellyn Foundation is at www.kellyn, which is KELLYN.org. And so that's Kellyn, which is KELLYN.org. And people say, what's Kellyn? Where did that come from? Why is that what your foundation is named? And it turns out that Kellyn is a Gaelic word. So my heritage is Welsh. And in Old Gaelic, Kellyn means warrior princess, but not necessarily warrior princess like Xena warrior princess, or, somebody on a horseback with a sword. It's more like the yin yang version, like the Gaelic version of yin yang. So it's about balance, because the goal for everyone is to kind of have a balance between your warrior side, which is your honor and your courage and ambition and strength, and then your princess side, which is love and empathy and service and creativity. Because if you're just one or the other, you're not going to be able to live a fulfilled and happy life. If you're just the warrior, you might get stuff done, but you might also be kind of cranky and grumpy and, not have people real happy to be with you. If you're just the princess, everybody will probably love you, but you may not be effective in getting the things done that would be best for you. So the goal is to be a warrior princess and be able to have that balance. Now, the reason we used that as the name for our foundation is back in 2007, when we started, we were really focused on childhood obesity and working with families that had risk factors for chronic disease within the family. And we were trying to come up with something that we could name the nonprofit foundation that didn't have anything negative in it, like overweight or disease, right. Or, we wanted it to be more on the positive of what are we trying to manifest? What are we trying to help people create? And it's not about the number on the scale or the number on their blood pressure cuff or on their lab values. It's about what are the choices that they're making and what's the balance in their life. So my co-founder and the chief executive officer of Kellyn Foundation is Eric Ruth, and he is the business guy. I'm the medical side, and he found the word Kellyn from my Gaelic heritage and said, "What, don't you think that this basically says what we want to do with the foundation?" And that's why we decided to call it Kellyn.org or Kellyn Foundation, and you can find us at Kellyn.org.
Yeah, that's beautiful. And I want you to elaborate more on how this is what you call a healthy neighborhood immersion strategy, because it really brilliantly, in my opinion, takes into account really tapping into community, so that you're really bringing that sense of social nudging into education, into the business world, into every aspect of community involvement. So talk a little bit about the various opportunities that the organization offers, and let's take them apart. Like you have gardening in the classroom, things of this nature. Let's talk a little bit about the different facets more in depth, so they're not so abstract to people. They could really feel the mechanics and the reality of what you're offering.
Well, I would love to say that we had this grand vision back in 2007 and we knew exactly where we were going, and now here we are in 2025. It didn't actually work out quite that way. The way it started, and as you mentioned, we now have what we're calling our Healthy Neighborhood Immersion Strategy. We've had that for many years now. But when we started, it was really more of a clinically based intensive therapeutic lifestyle change program for families, kind of like group visits and goal setting and structured exercise. And that's where we started, because that's where, for me as a physician, where I felt there was a real lack of anything in our area that families could participate in to try to help them move to healthier lifestyle choices. So I did not know about Hans Deal back at that time. I didn't know about the CHIP program, but basically it was a very similar type of a thing where they would work with us for 3 months intensively, doing group visits and goal setting things, doing their structured exercise, and then they'd go into like a 9-month maintenance period. So that was what we now call Kellyn Lifestyle Medicine, and we do still do the intervention programs, but we've shifted them over the years so that now it's more adult. We still do families, but more for adults in the community, self-insured employers, things like that. That was our first pillar. But as we were going through that, we realized that when the families when they were doing the intensive time with us, they were doing really well with their lifestyle changes and they're feeling better. Things were going well. But when they left the program, then they were really surrounded by that kind of the social norms that were pushing them in the wrong direction or in the less healthy direction. And they struggled because the environment around them was more obesogenic and or more, the choice architecture was less supportive. So my co-founder, Eric, and I said, well, how can we start to change the culture in the Lehigh Valley? And we know that relationships is the key. Just like you said, we want to do the things that the people around us are doing. That makes it so much easier. If everyone around you is, growing some food in their garden or creating amazing plant-forward meals, there's a good chance that you're going to do that too. Mm-hmm. But if everybody else around you is getting takeout every night, that's kind of probably what you're going to do. So we said, okay, where could we make the biggest impact? And we thought the schools would be the best place to start. So we started doing in classroom programming in 3rd, 4th, and 5th grade. So we go to within each individual classroom instead of having it be a big auditorium or, only for the after school program. And we teach about what's real food and how do you do label reading and about screen time and eating out survival skills and things like that. And then
what were the obstacles of getting into the school system? Let's talk about that.
Oh, that was a great question. So we were so lucky because I am actually the physician on the Easton Area School District Wellness Council. So I had already been that. And when we made the decision that we really thought getting into the schools would be a great idea, we basically went to the assistant superintendent of the Easton Area School District and he said, sure, go ahead. So, we were really fortunate that way because we already had the relationship. So again, it comes back to relationships. We did have to go talk to the school board and tell them what we were going to do. But because we were already a kind of a known entity, or I was anyway, as a doctor, they allowed us to do it as long as the funding wasn't coming from the school district. We had to figure out our funding from other ways. And then once we started in Easton, we did that in 2009, then another school district just over in the next town in Bethlehem said, hey, how come you guys aren't coming to our school? So it just sort of spread out in a way, almost from principal to principal, teacher to teacher, superintendent to superintendent, where within a couple of years, we are now in 10 different school districts. We do 3rd, 4th, and 5th grade in 46 different elementary schools, and we reach over 10,000 students a year in this longitudinal curriculum that also includes that Garden as a Classroom program where we build school gardens, raised beds on the school property, and then we take the kids through a whole journey from seed to harvest. They grow some of the tomato plants and herbs on their windowsill. We plant outside when it's warmer in May, and then the families are able to help take care of the garden during the summertime and harvest the produce and take it home. So that's
that involves both that practical aspect and some didactic lecturing and information that way too. How does that work?
Yeah. So we actually have the didactic information because of COVID. We used to just do it on a PowerPoint, but it took a lot longer to do that with the kiddos because anybody who's ever tried to get into the school system knows that the school does not have a whole lot of time. There's a lot of things going on that they need to do. So if you're coming in as an outside kind of assistant or adding education, you have to make sure you can fit within the time that they have during the day that's not at specials and not at reading and not at math. So when we had when we were going in and doing the whole presentation from a PowerPoint, we had to go in and have at least an hour block per classroom, which is a chunk of time. But it worked out. We were doing it. It was just a little bit harder to schedule. Then COVID happened and we weren't able to be in the schools at all. And that actually forced us in a good way to make videos of our presentations. And so what we do is send in the videos to the schools where they can watch that ahead of time. So they get kind of the didactic part done. Then we come in for a half an hour instead, and we play games with the kids about the information. So it's very interactive. We have food together. We play almost like a Jeopardy game. And then when we're talking about the Garden as a Classroom program, that's very experiential. The kids are doing the planting and doing all that stuff. So it's a mix of didactic and experiential and multiple touch points throughout the year that builds longitudinally on that 3-year curriculum.
Well, I'm going to play devil's advocate because as you're educating these children, they're going home to parents that have no idea what you're talking about in some cases. So what were the obstacles and the backlash to that, where now the kids coming home and saying, you know what, our whole eating plan needs to shift in this kind of a direction. So talk a little bit about what that brought up in doing that.
Well, we definitely got some phone calls and emails from parents, as you might imagine. But the majority of them were actually positive because we send home handouts and we really try to to not say that we try not to be very black and white and dogmatic of like, you can never, ever eat X, this type of food again. We really try to just talk about adding in more of the healthier foods, or
Well, let
what
me
we
ask
would
you that.
think.
Is that part of the Kellyn part where you started doing home plant-based cooking classes for the community people? So that involved an outreach that went beyond the schools into that
Mhm.
aspect of the
Yep.
community, right?
Yep,
Okay.
absolutely. And sometimes the kids, well, what we get a lot of calls from the parents about is they said, our kid came home and said that they liked eating salad. What salad did you give them? And we
Right.
say, it's growing in the school garden. You're welcome to go harvest some. Yeah. So it's
Right.
that definitely helps. In general, it's been positive, but there have definitely been parents who have been concerned, especially if they're not able to access that type of food. And that's part of what the Eat Real Food mobile market and the food access piece for Kellyn Foundation was designed to kind of address. Was we were having kids in the elementary schools say, I can't get the foods that you're saying are the healthiest things for me to eat. And that's part of why we realized there's 8 different areas, kind of census tracts in the Lehigh Valley that we serve, that are classified from a national standpoint as food deserts. So we know that that's a big issue for us, and that's part of what I would say our first pillar was the intervention program. Our second pillar was the school program. Then the Kellyn Kitchens and the culinary medicine and the Eat Real Food and the food access mobile market. That was our final piece of the
Yeah,
Healthy
talk
Neighborhood
about
Emergency
that piece because I found that interesting because that piece interfaces with farmers that are local and
Plan.
and all of that. So let's talk about that because when I looked at this whole pattern, it's just absolutely brilliant. I loved it. So talk a little about the Eat Real Food mobile market thing and explain that a little bit.
Well, I'd love to, because I think that when people say, how could we get started as far as like doing something like this in their own community, I would not say start with the mobile market. I would say start with some of the other pieces first, build your network and your relationships. But
Right.
access is critical, because education alone is not sufficient if you're not able to actually access the food that people are talking about. So as I said, that was the fourth pillar for our Healthy Neighborhood Immersion strategy. But we had been talking in the Lehigh Valley in some of our roles as advocates about a mobile market or other ways of getting the local farm economy, the local food into the neighborhoods that need it the most, because we're fortunate that we have still a lot of farmland here in our area, but a lot of it's used to grow corn and soy, for animal feed. And so we really wanted to help our, the orchardists, the people who had the fruits and the small vegetable farmers get another market within our region. And we, a mobile market is a great way to do that. So there was another philanthropy, another foundation called Two Rivers Health and Wellness Foundation, who approached us and said, we really would like to do something about the food access issue here in the Lehigh Valley. We think you guys are the ones that can operationalize it. Would you be interested in exploring that? And so we explored how we could be most effective and still be able to bring in food from the local farms, but also be able to provide what our neighbors in these communities really wanted to eat. Because we've seen that, just food boxes, if you don't have food, you don't have calories, any calories are helpful. But
Right.
choice is really, really important when you're talking about people shifting and changing their habits and eating the food that you're hoping that they do. So what we were able to put together was, we have probably about 12 to 15 local farmers that we source from. And then we also source from other large produce distributors, because we want to have a rolling grocery store on wheels, at least a produce department on wheels.
Right.
We don't want to just have what's in season in the Lehigh Valley, because then you may not be able to get everything that you need to make your meals. But if it's in season in the Lehigh Valley, we want to source it from our local farmers. So that way we are able to kind of flex. When there's broccoli here, we buy it from local farmers. When there's not broccoli here, we buy it from someplace else within the country, so that we can always have broccoli. And
Right.
same thing for onions, and same thing for apples. And, there's other things that people in our community are really going to want to have as part of their meals that don't grow here at all, like avocado or mango or things like that. So what we do is basically source the produce, bring it into our little mini food hub. make sure that it's processed if it needs to be, in the different bags or washed or whatever. And then we take that out on the mobile market into these neighborhoods so that we're there at the same time every week. They can count on us as their grocery store. And we also have things like whole grains and lentils and rice and beans and also the actual prepared meals, because that's another really key piece of convenience and making the healthy choice the easy choice. Is the ingredients are great. Some people are going to be able to cook with it. Other people, it's just better for them to be able to get a grab and go, container of chili or of a power bowl or a salad, like a citrus and beet salad like we had this week, because that kind of takes a page out of the fast food world. Why do they go through fast food, or why do they use as much fast food? It's because it's convenient and it's cheap. Now, we can't make all healthy food cheap, but we can make it more convenient. So we kind of have everything from the produce to the actual prepared meals so that people can get what they need right in their neighborhood.
And do they have to sign up for that when they come to the market, or is it first come, first served? How does it work?
So there's a whole range of the way people can access the food. We have many people that purchase the food, because it's just a way to get local farm food, or they like the lifestyle medicine meals. So if you're standing in line at the mobile market, you can't tell if somebody's paying full price and they're just doing it with their credit card or with cash, or if somebody has a voucher program and they have a discount. Because once we have you signed up in our system, if you're on a discount program, then you're in our system. So all you need to do is come and get your food and say what your number is. And then whatever that discount is comes off at the cash register. So you can't tell this person's getting $20 off and this person's getting $15 off and this person's paying full price. You can't tell. It's just part of everybody in the community coming to the market together.
Meagan, another pillar of your program that I thought was interesting, because I realized you as a physician are interested in helping to train other physicians in the mindset of what this is about. Like my good friend Michael Clapper has his Moving Medicine Forward, which is but you on your own scale have been doing exactly the same thing, where you're actually going into medical schools, residency programs, and turning on these budding physicians with this process. Talk a little bit about how you implement that.
Oh, I love our medical students and residents. They're wonderful. They just really kind of, they make my heart happy. They inspire me again about why medicine is such an amazing career, because they are still so passionate and still idealistic and ready to go out and just, make a difference in the world. So what I've been doing, I guess, over the past 20 years or so now is initially I was just going to residency programs and doing lectures during their didactic day, kind of like what Michael Clapper does, though his story about what I wish I knew in medical school is awesome. So he has quite a great presentation. But I was going to family medicine residency programs in our area and just talking about lifestyle medicine. What then eventually has evolved since then is, and also going to grand rounds at different hospitals, trying to get the attending physicians to also get on board with all this. So that was stuff I was doing for in general, a couple times a year. But then when we got to the point with the American College of Lifestyle Medicine, that there was something called the Lifestyle Medicine Residency Curriculum, which is a program that can be integrated into any residency really, but primary care is one of the most common ones that it is. So internal medicine, family medicine, psychiatry, things like that. That started back in the first beta test for any place was in 2018. But when it was rolled out as kind of like an initial, let's see who could possibly do this across the country, I was hired to be able to integrate that into our local family medicine and internal medicine residency programs. So in 2019, I started being a part-time, I guess you would say, faculty member for residency programs. And now I'm also doing it for psychiatry. I'm having now endocrinology residents and addiction medicine residents come through the things that we do. So it's become a really big piece of what I do is teach residents about lifestyle medicine over the course of their whole residency program. So not just one lecture, but integrated within their curriculum. And then for the medical students, I'm the faculty mentor for the Lifestyle Medicine Interest Group for the Temple St. Luke's Lewis Katz School of Medicine crew. So I'm teaching first, second, third, and fourth year medical students about lifestyle medicine as well, and then helping them, if they're interested, kind of transition to residency programs where they would be able to learn more and then become board certified.
So with all of that, what do you do in your spare time?
I play with my twin grandbabies.
There
I'm
you
so
go. There you go.
excited. Yes, I have 8-month-old grandbaby twins, and I have to tell you, if
Oh,
there's anything that makes you want to live to 100,
that's it.
that's
That's
that
it
right
right
there.
there. That's it right there. So what's on the horizon for you, Megan? What else would you like to be involved in with the foundation, with the organization, or is it more of the same, or do you have some vision of something else happening with all this?
I would say personally, I love what I'm doing with the American College of Lifestyle Medicine as being the secretary on the board of directors and the conference chair and part of different task forces that are really looking at how can we operationalize and scale lifestyle medicine across the country. So I think that's really important to continue with that and expanding that. But as far as Kellyn Foundation, two things that I'm really excited about. We definitely want to keep the school programs going. That's really, really important. We definitely want to continue with the culinary medicine and the cooking classes and the lifestyle medicine meals that we talk about. But I'm interested and excited that we may be able to start to expand more into medically tailored meals, potentially being covered by insurance, with Medicaid 1115 waivers becoming more popular or more accessible, and some of the other things that the healthcare systems and the insurance systems are sort of shifting to more food as medicine. We should be in a good position to actually be able to regionally perhaps provide medically tailored meals, and then the nutrition education that goes along with that. So not just the food, but also the why, like you said, the why. Why
Yeah.
are we doing this? And hopefully getting the social support and the relationships for people, so that it's not just them. There's other people in their community that are doing it too. So medically tailored meals is something I'm really excited about. And another thing is the intensive therapeutic lifestyle change cohorts that we do out in the community. It's usually about 30 households that we do these year-long programs with. I am hopeful that we will be able to get more insurance coverage, Medicaid, Medicare coverage, so that people, instead of it having to be either philanthropically grant funded or through a self-insured employer or self-pay, those are great, but there's a whole lot of people who could really benefit from those programs that are not able to access it through either of those three ways. And so we're looking at ways to actually get coverage for some Medicaid patients and Medicare patients in our
Well,
area.
that coverage will be easy. Are you involved in data collection to expand the evidence base of that? Is that what's
Mhm.
happening too?
Yep. So we do biometrics and labs and everything
Okay.
along with it. So fingers crossed that people will eventually, when I say people, I mean insurance programs, will eventually start seeing this as a worthwhile bundled payment program.
Well,
Because
show
as you
them that
know,
you show them you can save them money with that evidence base. That's when they jump on board. That's what it's
Mhm.
all about for them. It's dollars and cents, pretty much. I've been on that road before. Megan, as we wind down our interview, are there any final words you'd like to share with the audience out here?
I think the most important ones is just look around in your own spheres of influence. You know, we all want to do these like big, massive, huge things, which is important. You know, it's good to have dreams to say, like, oh, I'm going to change the world. But what's really more effective or impactful, I think, is look around in your own spheres of influence and say, what's something I can do right now that I'm going to be able to sustain doing so I can continue doing it. So I think part of what has been the most effective for Kellyn Foundation, that's really been part of our success, is that we've been in the same community for now almost 18 years,
Right.
working with people, building those relationships, so that now when opportunities arise, we have a whole network of people that we've worked with. They know us, we know them, we know what they can bring to the table and what we can bring to the table. And so it's making us a lot more effective as time goes on, because we've built those relationships, and other people have also built that web around. You know, it's kind of like a virtuous circle. When you start it, then it goes out and out and out and out more. I think a lot of people in the lifestyle medicine movement understandably are frustrated. They're frustrated with the jobs that they have and what they're able to do within their day to day. And I hear that. That's a real thing. But
Right.
for all of us, looking at where can I maybe start? Maybe I'm starting by just having a once a quarter whole food plant-based potluck at my place of worship or my community center, or maybe I have a relationship with one elementary school. Could I start doing a gardening program with that elementary school? You know, it really depends on where you are and who you have connections with. But I think starting small and then other people will start to come to the table. They'll see what you're doing. They'll think it's exciting. They'll want to get involved. And then those different things sort of like ripple out, because like I said, we did not start with the healthy neighborhood immersion strategy. You have to start with one thing, do that well for a while, and then let it expand out. And then the other important thing is try to find your tribe, so that you have other people to talk to about this, because it can get lonely if you're the only one who's kind of on this bandwagon. So find your tribe and they'll help you thrive.
Well, I can't thank my guest, Dr. Meagan Grega, enough for being with us today, sharing her insight, her information, showing how, it's a lot easier than you think to be healthy, and making the healthy choice, the easy choice, is well within your reach. You can see, I urge you to follow the Kellyn Foundation and Dr. Grega. You can see her URL scrolling across the bottom of the screen. And I will mention that Dr. Grega will be a featured speaker this summer at the convention of the National Health Association on June 26th. And we look forward to hearing her there and seeing her there. And I want to thank everybody that joined us today, because without you, we can't do what we do in our own little healthy community. And I want to really acknowledge and thank you for being part of this healthy NHA family. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino, and I look forward to being with you on the next episode of the Health Science Podcast. Dr. Grega, thank you so much. Thank you, Meagan.
Thank you, Frank. This was a pleasure.
You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.